Hi, my name is Joe Bellick, and I'm the founder of Bellick Law, LLP. We are proud sponsors of the Mesothelioma Research Foundation. We have been honored to do this work for 25 years, representing people with mesothelioma and their families. And part of our commitment to our clients is to give back and sponsor research and advocacy efforts and engagement across the mesothelioma community.
Hi, I'm Trey Branham. Dean Omar Branham and Shirley is proud to sponsor this year's Mesothelioma Applied Research Foundation Conference. The 34 lawyers at Dobbs have more than 400 collective years providing legal representation to victims of this insidious cancer. We applaud the leadership of MARF and this community for its tireless dedication to finding a cure for this totally preventable disease.
Hi, I'm Mary.
And I'm Morgan, and we are registered nurses at MRHFM Law Firm. Our firm exclusively helps mesothelioma patients across the country navigate their diagnosis as well as any of their legal needs. The Mesothelioma Applied Research Foundation has done an incredible job advocating and educating mesothelioma patients. They built a supportive community where patients can find the most up-to-date medical information, as well as be surrounded by a community of other people going through a similar journey.
MRHFM is honored to continue our support of their mission and to be a part of the advocacy and awareness they bring to mesothelioma cancer.
Welcome to this episode of MesoTV. I'm Julie White from the Meso Foundation, and I'd like to introduce you to Amanda Goodstadt, who is a senior staff attorney from Triage Cancer. For people who don't know Triage Cancer and what you do, could you introduce yourself, Amanda, and tell us a little about you?
Sure. Thanks for having me here today, Julie. Triage Cancer is a national nonprofit organization. We provide free education on legal and practical issues that can impact people who've been diagnosed with cancer and their caregivers. So we provide education on all of the different things that can arise in connection with the diagnosis that aren't medical. We do a lot of educational programming, both virtually and in person. We're often out in the cancer community meeting people at events. We create a lot of resources, written resources, video resources. We have a whole collection of animated short videos and a podcast. We really want to reach people in whatever ways they like to learn. Among the many things we do, we have an individualized legal and financial navigation program where we talk to folks who have cancer, we talk to caregivers, we talk to healthcare providers about topics like health insurance, employment rights, disability insurance, estate planning. So if any of this sounds interesting to people and you want to access our resources and learn more about what we do, it's all available through our website, which is triagecancer.org.
I've referred several patients there. You're a wonderful organization. Today I'd like to talk about some of the questions that I get most, and I am hesitant to answer sometimes because I don't have the knowledge that you have, so that's why you're here.
Sure.
First, people hear the word Social Security and they're not sure what it all encompasses. Can you sort of walk us through the difference between SSI, Social Security Disability, and then just the difference between those two?
Absolutely. This is a topic we talk to people about quite often. So to start with, SSI stands for Supplemental Security Income, and SSDI stands for Social Security Disability Insurance. Those two programs have certain things in common, and in certain ways they're very different. So I'll start by sharing what they have in common. They are both long-term disability insurance programs that are administered through the Social Security Administration. They both use the same very high standard to have somebody be considered disabled. So To meet that disability standard for either SSI or SSDI, someone has to have a medical condition that has lasted or is expected to last for at least a year or result in death. And that condition has to be so severe that the individual is no longer able to do the work that they were most recently doing, and that they're no longer able to adjust to any other kind of work. It's a very functional definition. It's not just about, hey, what do you have? What's your diagnosis? It's about how does that diagnosis affect your day-to-day such that you're limited and unable to work. Now, that's sort of what they have in common. There are other ways in which the programs are very different. SSI is a program for people who are 65 and older, or blind, or disabled according to that definition I just shared. And it's for people who have very low income and very low resources or assets. To give you a sense of that, the maximum benefit that someone would get under SSI each month this year is $994. And to be eligible, an individual has to have no more than $2,000 in resources, and a married couple no more than $3,000. So this is a program for people who are very low income. And one of the other benefits besides providing some income to those individuals is that people who are approved for SSI are also eligible for Medicaid. Now the SSDI program, totally different criteria. That's not about someone having low income or low resources. That's about someone's work history paying into the Social Security system. Think of it as a way to access your Social Security retirement benefits early because you've become disabled and unable to work. Someone has to have worked long enough and recently enough to be eligible. Generally speaking, for an adult, that's working and paying into Social Security 5 of the last 10 years. And then the benefit someone gets depends on their work history. So it can vary in amount depending on how much someone's paid in Social Security taxes.
Thank you. We hear sometimes about the compassionate allowance list for Social Security disability, and that both pleural and peritoneal mesothelioma are on this list, and that it helps to expedite the process. Can you explain what this list is?
Yeah, absolutely. So the compassionate allowance list is a list of certain medical conditions that by definition meet Social Security standards for disability benefits. So someone who's applying for benefits can show that their diagnosis is on the list. As you mentioned yourself, it expedites processing of the application. When someone applies for benefits at Social Security, it can take a really long time. It is not uncommon for it to take 4 to 6 months, longer even. However, there are certain individuals who get to expedite that application, and one set of those individuals are people where the diagnosis is on that list. Now, being on the list doesn't mean you automatically get benefits. What it means is that when Social Security is looking at the stack of applications coming in, they should be pulling your application and putting it at the top of the pile.
Is there any documentation that you need specially to apply under compassionate allowance?
So if you're applying and you know your diagnosis is on the list, it is helpful for you to flag that for Social Security. You can actually go to Social Security's website and you can see the list. You can see the language that the diagnosis is described with, and it's helpful if you're using that same language. It's also helpful if you're talking to someone at Social Security to make sure to point out what your diagnosis is. Social Security should know just from looking at the application. They should pick up on this on their own, but our feeling is it does not hurt to help them along with that and point it out.
Are there any common mistakes you see patients make when they're applying for Social Security, or if they're denied, what would be the thing they should do?
So good questions. In terms of mistakes, I would say one tip that we often share with people that they can think about is talk to your healthcare provider if you are applying for these benefits and make sure they know. We sometimes see people run into issues because part of the application is you're going to tell Social Security the names and contact information for your providers. And then Social Security is going to reach out to those providers and request medical records. They're going to look at the medical records and they're going to see whether the story that those records tell is consistent with the other information in your application, like when you're reporting on what your day-to-day looks like. We find that sometimes patients, when they go and see their provider, they are putting their best foot forward and they are trying to be positive. And so the provider will say, well, how are you doing? And they say, I guess I'm doing pretty well. And they don't elaborate and they don't necessarily share the details of some of the limitations they're experiencing. And then that becomes problematic if they tell those details to Social Security and then Social Security looks at the medical records and says, I don't know, it seems like all this doctor's notes say the patient's doing well. And then that can be further confusing if the doctor's notes suggest that the patient is also physiologically doing well. Like maybe there are notes about how treatment is working really well and the cancer is responding to that treatment. Of course, we know that doesn't tell the whole story. That doesn't mean that someone is necessarily doing great, but we want to make sure that the doctor is involved in the application process and can be an ally.
So if they're denied, what would be the next step? Do they need to hire one of those attorneys?
So definitely if someone is denied, which does happen because Social Security denies way more claims than it approves, they have the right to an appeal. And there's a 4-step appeals process. The first step is a request for reconsideration. Someone does not have to hire a lawyer for this step. They certainly have the option of doing that if they have if that would make them feel supported in the process. But we want people to understand that it's not a requirement and it can be done on your own. I think the initial thing that's really important for people to know is there is a deadline. You have 60 days from getting your denial letter, and Social Security assumes that you've gotten that letter 5 days after the date on the letter. And what happens if you don't appeal in that time frame and you can't show good cause for why you weren't able to do that, like maybe, if you were hospitalized and unable to, then to pursue the benefits, you're going to have to go back to step 1 and start all over again with an initial application.
So immediately they need to reapply. And is it a complicated process that they need an attorney for, or can they do it on their own?
So you do not need an attorney. It is completely up to the individual. This is a process that someone can do on their own, but if they would like the support of a professional, the advantage to using a lawyer is typically Social Security disability attorneys only practice in this area of the law. So they are quite accustomed to the system and to the players who are local to their Social Security office.
Do they keep a percentage of the person's award, or?
So how they are paid is highly regulated. They can take up to 25% of any past due benefits, but there's a cap of $9,200 on that. And when those attorneys are paid, you, the applicant, don't pay them. They're paid directly from Social Security. Social Security takes what they're owed out of your past due benefits. Those benefits are typically paid in a lump sum, and they will take the portion that's owed to the attorney and pay the attorney directly.
If a patient is wanting to do an appeal, though, and just needs some advice, they can reach out to Triage Cancer and get some advice on how to get started on their appeal, though, for free, correct?
They can absolutely reach out to our legal and financial navigation program, and we're happy to talk to them about the appeals process and about strategies that are good ones to use when involved in this process.
Another question many patients ask me and are confused about is once they receive the Social Security disability, are they allowed to work while receiving that, or will that disqualify them or get them kicked off?
So that's a great question. Once someone is receiving benefits, they are responsible for reporting any income from work to the Social Security office. Now, Social Security has an interest in people returning to work, and so they have certain programs to help people transition from getting benefits back to working without jeopardizing losing all those benefits all at once. For example, they have a trial work period program where someone can work for a certain amount of time and earn whatever they can earn without losing their benefits. But it's very important that if people want to return to work, that they do that and let Social Security know about it and do it following the rules that the Social Security Administration has.
But they can't work part-time indefinitely.
It would depend on the circumstances. It would depend on how much money they're making and whether they've gone through their trial work period.
But the biggest point is always let them know about any work you're doing.
You're obligated to let them know.
Yes. Okay. There's a Medicaid waiting period after you're accepted for Social Security. Could you explain what that waiting period is?
Sure. I just want to note, not Medicaid, Medicare.
I'm sorry, Medicare.
It's okay. Medicaid is associated with SSI. Medicare is associated with SSDI. And yes,
I misspoke. Yes.
No problem.
I meant Medicare.
People, that mixes up a lot of people. Mm-hmm. There is a 2-year waiting period for Medicare. So specifically, someone who gets SSDI becomes eligible for Medicare 24 months after their entitlement date. So 24 months after they start receiving cash benefits is when they would be eligible for Medicare.
So what would their options for health insurance be during this waiting period if they're under 65?
It's going to depend on the circumstances, but their options could include COBRA, could include employer-sponsored coverage through a spouse, marketplace coverage, or even Medicaid if they're eligible under their state's rules.
And if they can't afford COBRA, but they don't qualify for Medicaid and they don't have a spouse, that would pretty much leave them with marketplace, I would assume.
Yes, and potentially marketplace financial assistance, depending on their income level.
Mm-hmm. Medicare, I know we don't have time to go through all of it, but could you just briefly explain, there's different parts of Medicare, and I know that that can be confusing. There's like A, B, C, D.
Yep. A whole alphabet soup. So
yes.
The very kind of short answer on that is, think of Medicare Part A as hospital coverage. That's the part of Medicare that pays for an inpatient hospital stay or a stay in a skilled nursing facility. Medicare Part B, think of as medical insurance. That's the part of Medicare that's going to pay when you go to the doctor, when you have a lab test, when you get a scan, all the outpatient services. Mm-hmm. Parts A and B together are what are called original Medicare, because that's all of Medicare that originally existed back when it was first signed into law. Mm-hmm. And if you have original Medicare and you want prescription drug coverage, that comes from Medicare Part D. Now, Part C created the Medicare Advantage program, which is a managed care alternative to original Medicare, another way to get your Medicare benefits. We actually have a lot of resources about Medicare, and I will just highlight on April 22nd, we're going to be doing a brand new webinar called Medicare Made Simple. It's designed for first-time enrollees. So that might be something to check out if you are new to the program or just want to refresh your memory on it.
Okay. So when people originally get Medicare, they get A and B automatically?
That depends. So for somebody who is becoming Medicare eligible because they are getting SSDI, so they're at that 25th month of SSDI benefits, they should be automatically enrolled into both Parts A and B. If someone is becoming Medicare eligible because they're turning 65, then they're automatically enrolled if they're already getting any kind of Social Security benefits. So for example, if they took early retirement. But if someone's still working and they don't get anything from Social Security and they're turning 65, they would have to proactively reach out to Social Security and enroll themselves.
And how would they get the Part D, the prescription drug coverage?
So you would, for that, you want to evaluate the different plan options. And then once you choose an option, you can either enroll by calling the plan directly, or you can enroll by calling Medicare.
And they have to pay for this?
So every part of Medicare has different costs that are involved with it. The part that a lot of people think about as not having to pay for is Part A. That's because 99% of people don't pay a premium for Part A. But Part A still has other costs like a deductible and cost share or co-pays, I should say. Part B has its own cost structure. Part D has its own cost structure.
Does Medicare have someone like an advocate or someone that people can call to help walk them through this or talk them through it?
I am so glad you asked that, because it gives me a chance to give a shout out to one of my favorite programs, which is the SHIP program, the State Health Insurance Assistance Program. Every state has one of these programs, and through that program, there are people who provide free, unbiased counseling to folks with Medicare and to their families. They can help people walk through Plan Finder and looking at Medicare options and understanding the difference between original Medicare and Medicare Advantage. Every state's program potentially can have a different name. So in some states, it's referred to as the SHIP, but for example, in New York, where I'm from, it's called HICAP. In Florida, it's called SHINE. If you look at Triage Cancer's state resources, we have contact information for each state's SHIP program, as well as the correct name for it. I highly recommend reaching out to a SHIP counselor if you have questions. And then of course, we have a ton of Medicare resources, and we speak with people about Medicare questions all the time.
That's great. The only other part is the Part C, and that you said is a Medicare Advantage. That would be if you chose to sign up for that, that would be where a managed care like a Blue Cross Blue Shield or one of these programs takes your insurance. Did they take over for your Medicare and they handle all of your healthcare needs, correct?
Right. So for Medicare Advantage, you're talking about a single managed care plan through which you're getting your hospital coverage, you're getting your medical coverage. Most of these plans also include drug coverage. They are sold by private insurance companies. They have a few different structures, but the vast majority are HMOs or PPOs. And you get your care, but it is limited to that plan's network. So that's a big difference from original Medicare, where you can see any provider anywhere in the US who accepts Medicare.
And that's why it's important to talk to the SHIP or whatever the name for that state is to find out what your options are, what your current doctors are, and would they still be able to see them, especially with cancer patients who may have several providers and need to be sure that their medicines and their providers would still be covered.
That's absolutely right. And be careful. I talked to some people who are part of, for example, a national support group, which is fantastic. But sometimes people will hear someone say, oh, you know, you should do this, you shouldn't do this, this is the best plan. But people have to remember that what's best for someone else isn't necessarily what's best for them. Sometimes there are differences based on state and based on someone's health situation and their own personal finances.
Yes. If you had to give mesothelioma patients and their caregivers, I guess, one piece of advice about navigating all these complex systems, what would it be?
Just one piece of advice, huh?
Well, I mean, an umbrella piece of.
I would say ask questions and be a proactive consumer. It's easier said than done when we're talking about someone going through treatment and or caregivers. You know, I realize people already have a lot on their plates, and this is asking for a lot more. But a lot of these cancer-related legal issues impact someone's ability to access care, and they impact their financial situation. So the sooner you can address some of these things, hopefully the more options you have.
Well, Amanda, this has been invaluable. I'm going to have a slide at the end that will connect people who want to access Triage Cancer and your resources. And I thank you very much for your time today.
It was my pleasure.
Thank you.
Thank you.